Hi everyone, my name is Merna and the title of my presentation is Evaluating the Impact of a Sexual Health Workshop for Staff in Stroke and Acquired Brain Injury Rehabilitation. ABI on stroke sexuality. So sexuality is such a critical part of health and well-being, and unfortunately, individuals living with ABI are seen as asexual, especially in the presence of other physical and cognitive deficits. As a result, they are unable to unface great barriers in communicating about sexuality with healthcare professionals. Sexual dysfunction and decreased sexual satisfaction are common post-stroke, and research shows that barriers to sexuality being addressed during rehabilitation include lack of sexual health policy in rehabilitation facilities, lack of knowledge, and low levels of comfort in healthcare providers. So in order to structure our quality improvement initiative, we follow the implementation framework. So we followed these 5 steps. We identified a question, we formed a team of different stakeholders, defined the current and future state, and we collected and analyzed data, and we implemented the quality improvement initiative. So patients started asking questions about sexual health. So we surveyed the patients early in 2021, and in the patient surveys, patients expressed that sexuality is an important topic to discuss, and they would like healthcare professionals to initiate conversations with them about sexual health. And staff were surveyed early in 2021. Staff said that they feel like they don't know how to approach the topic appropriately with patients, and they, however, said that with appropriate training and education, they would feel more confident and comfortable addressing the topic of sexual health with patients. As a result, sexual health was identified as a gap, and the Quality Improvement Initiative was launched. The Quality Improvement Initiative was launched with the goal of addressing sexual health concerns of patients across the rehabilitation continuum of care. So the purpose of this Quality Improvement Initiative was to determine the impact of a sexual health workshop on the knowledge, comfort, attitude, and approach towards sexuality in the ABI and stroke units. The workshop was virtual and in person. It was a full-day workshop offered on 2 different days. The workshop was an interactive. Clinicians completed the knowledge, comfort, approach, and attitude towards sexuality scale, or KCAS, before and after the workshop. And here's an overview of the workshop. So sexual health was defined, common barriers and myths regarding sexual health and disability were discussed, as well as common sexual health concerns and interventions in stroke and ABI, and useful resources for clinicians and patients with ABI and stroke, among others. And communication strategies were also discussed, and clinicians engaged in role plays and case scenarios to put the skills into practice. 108 clinicians attended. 80 completed the pre-workshop surveys and 73 completed the post-workshop surveys. So the results show that knowledge about sexual health increased from 29 to 69%. Comfort in addressing sexual health increased by 20%. Approach towards sexuality increased by 19%, and readiness to apply the skills clinically increased from 22 to 76% after the workshop compared to before the workshop. Overall, 78% of staff felt ready to integrate the learning from the workshop into their clinical practice, and 89% of staff noted that the workshop was a valuable learning opportunity. We also have some quotes from the qualitative data that we collected. The whole workshop was great. Before the workshop, I felt ill-prepared to deal with patient concerns regarding sexual health. I'm very thankful for the info today, definitely leaving more confident in having these conversations, education, and resources. In conclusion, the findings of this Quality Improvement Initiative shed light on the importance of staff education in sexual health. Feedback from surveys will be used to develop future education and coaching opportunities to support staff. A 6-month follow-up also will be conducted using KCAS to evaluate the sustainability of the learning outcomes.